I wish to welcome you to the Ugandan High Commission, and because of the very important work you are doing in Uganda, we are glad that we've been able to host you here. And we pledge our support, full support to you, and once again to welcome you to the Ugandan High Commission for God and my country.
Thank you very much indeed. So I'm just going to give you a short summary of what we tried to achieve when we were in Kampala, and also what GAFI is trying to do. We have issued this new report following our Global Fungal Infection Forum 3, and one of the key requirements from that is that we're looking for hospitals and governments to adopt the diagnostic tests that have been accepted by the WHO. This list will be extended over coming years as well. And we really want this to happen as soon as possible, and the timeframes are important for us. So in 2015, there were just over 1 million deaths from AIDS, and it's been coming down very slowly over the last few years, but it's still very high, and nearly 50% of those deaths are related to fungal disease. The people who die of AIDS are often in the prime of life. The average age of death for cryptococcal meningitis and histoplasmosis is 35 years. What that translates to is about 1,300 people dying every day of a fungal infection related to AIDS. This is a really bad event for families, communities, and countries. Now, if we could make only a 15% improvement in diagnosis and treatment, only 15%, and we should be able to do better than that, that means that 200 more people will survive every day. And that is definitely worth doing. So to come back to what are we trying to do today, we're trying to ask hospitals and governments to adopt these tests, to accept this essential designation by the WHO, and to take those tests and apply them in country. That's essentially what we want them to do. And that is going to require a thought process within countries about how to grow that capability, how to make that happen in each country. And it will vary a little bit by health system and by test. And that essentially is what we want to avoid, leaving anybody behind. There's just too many people at the moment who don't have access to diagnostics and treatments, and that's essentially what we're trying to achieve. So now I'd like to ask Dr. Felix Bongerman, otherwise known as Bongo, to come and give us a short talk.
Thank you very much for this opportunity. Good evening to everyone. My name is Felix Bongerman. I was born and raised in a district called Kitgum, which neighbors South Sudan, very near to Juba than it is to Kampala, actually. After completing my medical degree from Gulu University, then I went again to a Gulu University teaching hospital. In that hospital, mainly because we did not have available diagnostics, so we relied on what a traditional doctor is supposed to do. Take good clinical history, examine the patients, and look for physical signs of illnesses. That was very challenging because it was very difficult for us to pinpoint to what the exact diagnosis is. The kind of scenario that I described above is classic for fungal diseases because they are often missed without appropriate diagnostic tests, which are often actually unavailable. And so we cannot advocate for better treatment, we cannot advocate for better diagnostics, and even for research funding, because we cannot bring clearly the problem to the world. We need diagnostics to be available, especially to areas where they're highly needed. And this includes low middle income countries where Uganda lies. So by identifying the essential diagnostics for this disease area, this report is a key step forward to diagnosis of fungal disease and other opportunistic infections in HIV/AIDS and patients and other immunocompromised patients, including those with cancer. And we hope that stakeholders at all levels will adopt this recommendation outlined in this report, and by working together, we can improve public health and save lives. Thank you.